Hello, welcome to the Men's Health and Awareness Educational Presentation. My name is Dr. Angelo Moore. I'm the Assistant Director for Community Outreach, Engagement, and Equity at Duke Cancer Institute. A little bit about the Office of Health Equity. We are an organization where our mission is to be the leader in reducing cancer health disparities in our catchment area. And our catchment area consists of approximately 41 counties in the state of North Carolina. And we do this through four different strategic initiatives. One is community outreach and engagement. So we normally go out in the community and educate people about cancer. We talk to them about what are some of the recommended screenings for cancer. And we answer their questions. And we also give them instructions and guidance on getting access to care. And so that brings us to our second initiative, which is patient navigation services. And we know we have a very complex healthcare system, and it can be very intimidating for people. So we have individuals that are trained to show you how to get the care and access to the care that you need. And we also work with individuals who do not have health insurance, as well as those individuals that are underinsured. There's a lot of programs out there that will at least help you get access to care, even if you don't have health insurance. Health disparities education. So there are some populations, some groups of people that have a heavier burden of a particular disease or cancer than other populations. And that's what we call health disparities. And so we provide education on what those look like. Clinical trials, education, and workplace diversity. We know that things have happened in this country to particular populations that was not ethical when it comes to research. And we understand that. And so one things that we do is we teach people what are clinical trials. We also teach them that there are a lot of things that's put in place, a lot of programs, a lot of rules that are put in place to make sure that those things do not happen again. And so that's very important for people to know that being in a clinical trial is actually another treatment option. And so our contact information here is below. And also another event that we do is we want to make sure that we are providing information to the community. So we have experts in their area to do presentations with community members, and community members get the opportunity to ask questions. And that is a great opportunity for us to be able to do outreach in the community. And so a survey was done with 64 people, 50% was female, 50% was male. We wanted to know what are some of the concerns that they had when it came to health. And some of the results from this study are as follows. 45% of the individuals who completed the survey said they did not have a regular doctor or a primary care provider, someone who they see on a regular basis. 56% of the participants expressed that they wanted help to establish one, a provider or a primary care provider that they can see on a regular basis. And 27% of the men who completed this survey said that they did not have a colonoscopy or participate in any colorectal cancer screening in the last 10 years. 30% of the men said they never had their prostate checked, and 76% of the participants said they wanted to know more information. And so therefore, we have created this educational event for that. Now, 37% said they wouldn't mind having it done electronically, via online, virtually. And so what we have done was we have taken the opportunity due to some of the restrictions we have because of the COVID pandemic. Some people don't feel comfortable being face-to-face. And some organizations have made restrictions on people not going out. So we developed this program and we're doing it virtually so that we can still meet the needs of the people who completed the survey. And so for the males, like I indicated before, there was 27% of the men had not had a colonoscopy or colorectal cancer screening in the last 10 years. And we had 30% of the males never had their prostate checked. And these things are important because these are two cancers, colorectal cancer and prostate cancer impacts, especially the African American and Black populations, the worst. And so while we're talking about cancer, because cancer is the second leading cause of death in males and females. So it's very important for us to talk about this. And so we need to focus more on prevention. And that's our goal. We want to prevent things from happening in the first place. So it's really important that we maintain really good health. In order to maintain good health, you need to see somebody on a regular basis to check and make sure that you're in good health. This is the opportunity where we do an exam or do screening to determine if there's anything that's abnormal early in the beginning, not when you start having signs and symptoms. And the thing about cancers is there are certain particular cancers that you have no signs or symptoms of. You think everything is okay, but there's something abnormal that's going on. So that's why you want to screen. And the important thing with screening is screening detects when something is abnormal before you start having signs and symptoms. When you start having signs or symptoms, normally that's in the later stages. And what people normally do is, if they don't have health insurance, they go to the emergency department, and you go to the emergency department, and they are not able to really give you the care that you need. They can stabilize you, but they're going to refer you somewhere else because they don't see patients on a long-term basis. And you want to avoid any complications related to any other chronic diseases like heart disease, hypertension, and diabetes in particularly. So like I said, it's really important to go on an annual basis. And one of the things about seeing someone on an annual basis is that's really an accountability person. So someone, that they can see you, you get a chance to know them. They can give you guidance on how to be healthy. As men, I will tell you that we need to pay more attention on making sure that we're healthy. I know we're taught to be tough, don't complain about things, but that can be to our detriment. Whenever we need care, we don't seek the care that we need. We need to make sure that we're healthy for our families, because we don't want to leave our families in such a way that they're having to take care of us, and we cannot work, we cannot provide for our families. So we need to make sure we take the time to make sure that we stay healthy. So getting an annual exam every year to have an overall evaluation of your health is really important. It's also during that time that your doctor or primary care provider will review vaccinations with you to make sure that you're taking vaccines that prevent you from developing diseases or illnesses. And at the same time, depending upon your age, they can tell you, okay, based on your age, based on your risk factors, your family history, we recommend you start doing these particular screenings to make sure that you stay healthy. And some of the things that they will check, checking your blood pressure. And normal blood pressure is anything less than 120, systolic, which is the top number, and over 80, which is the diastolic number. So you have 120 over 80. If it's less than that, that's considered normal. If one of the numbers are higher, it's still hypertension, whether it's the top number or the bottom number. So both the numbers need to be below the recommended 120 for the top number and 80 for the bottom number. And the important thing is, most people who have high blood pressure or their blood pressure is elevated, you don't have any signs or symptoms. You may hear some people complain, I have a headache, or those type of things, but normally people do not have any symptoms. So it's really important for somebody to check your blood pressure to see if it's normal. Because if no one ever checks you, you're walking around here with hypertension and don't know it. And while you're walking around with hypertension, you're having a lot of damage that's being done, especially to your heart and your kidneys. I know you've heard some people that they are on what we call dialysis. And these individuals, a lot of them, if you look at the history, they've had years and years of uncontrolled blood pressure. Cholesterol screening is very important. And the cholesterol is the amount of fat, that's in your blood. And the cholesterol is made up of 4 different areas. You have you have your overall cholesterol, you have triglycerides, you have HDL, which is high density lipids, which are the good lipids. Then you have LDL, which is low density lipids, which are the bad that's the bad lipids. And so that number needs to be as low as possible. And those are the lipids or the fat that stick in your arteries. And as it clogs up your arteries, that's what causes a heart attack, because your heart's not able to get the blood that it needs. Blood glucose screening. So there are some people who have a family history of diabetes, or, people say, I have sugar. And, it's not healthy for you to have free floating sugar or glucose in your blood. And so you, during this visit, you can do an evaluation where they screen you to see if you're at risk. And if you're at risk, they can take some blood to determine whether or not you have diabetes or not. It's important to know if you have strong bones. So we can evaluate you to make sure that you don't have any osteoporosis. And I cannot stress this enough. Being overweight and being obese is very detrimental to your health. It impacts your blood sugar levels. It impacts your blood pressure. It also puts you at risk for cancers. And so it's really important to make sure that you stay within a relatively normal weight. And by you having someone to be evaluate you every year, you get the opportunity for somebody to say, hey, I've seen you gain 10 pounds in the last year. And so that's the opportunity to do some modifications of your diet and institute some exercise to make sure that you lose those 10 pounds. And so we talk about diabetes, normal blood sugar. If you look in the green at the very bottom, A1C, which is the hemoglobin A1C test, this is a test that'll tell you what's your average blood sugar over an average of 3 months. So it's what your blood sugar has been over a 3-month time span. And so if it's 5.7 or below, that's considered normal. If it's between 5.7 and 6.4, that's considered pre-diabetes. And then if it's 6.5 or above, that's considered diabetes. And so what we want to do is make sure that we identify people in the pre-diabetes stage and work on some things to make sure that you don't have diabetes. The other column talks about fasting blood sugar. So a fasting blood sugar less than 99 is considered normal. A blood sugar 100 to 125 is considered pre-diabetes. And a blood sugar 26 or above is considered diabetes. And so the fasting blood sugar is a one-time test. They tell you not to eat or drink anything for 8 to 12 hours. They can check your blood, a finger prick, and see what that level is. But the hemoglobin A1C, that's a better, give us a better view of what your blood sugar has been over the past 3 months. So most providers and doctors use that to determine whether or not you have diabetes. And then the glucose tolerance test normally is used with women that are pregnant. They give you a solution and have you to drink it in like 2 hours. They check your blood sugar. They check your blood to see what the sugar level is to make sure your body's able to absorb it. So normally we don't use that to diagnose people. Normally it's used for women because some women will develop what we call gestational diabetes while they're pregnant. And we know if they develop that during pregnancy, it really puts them at risk for developing diabetes later on. So it's really important that to make sure that we are getting the proper vaccinations that's recommended. And, and vaccinations is something that, we do ever since, a person is born. We have vaccines to prevent things from happening because your immune system is not built up and it's not that strong. And so vaccines are a way to help build up your immune system. And so here, we talking about for adults, even though there's vaccines that we use for children, those are okay, but I want to focus on more for adults and young children. So for instance, the tetanus, you take a DTaP, which is a combination of vaccines when you're younger, and when you get older, we call it, a booster. And so that's recommended every 10 years. you have flu vaccine, and we're in the flu season right now. And we want to make sure that we encourage people to take the flu vaccine. We know that COVID is here, the pandemic, but so is flu. And so we need to make sure that we also vaccinate with flu as well. And the flu vaccine can be taken 2 weeks apart from the COVID vaccine if you take that. HPV vaccine. HPV is the virus that causes cervical cancer in women. And this particular vaccine prevents you from developing these viruses that causes cervical cancer. And one thing that I want to emphasize is this is a vaccine for boys and girls, starting at age 9. And people right now, they have the tendency that the girls get the vaccine, but they don't necessarily have the boys to get it because boys doesn't have a cervix. We know that. However, they can carry the virus and pass that virus to the female, and she can develop cervical cancer. So I want to emphasize this vaccine is for boys and girls starting at age 9. Another vaccine, if you're 65 or older, we recommend you take the pneumococcal vaccine, which is the vaccine to prevent you from developing pneumonia. And this is especially important if you are a smoker or you have asthma. Shingles is another vaccine that we recommend starting at the age of 50. So shingles is the same virus that causes you to get chickenpox when you're young. When you get older, it comes back with a vengeance, and so we recommend if you're 50 or older that you take this vaccine to prevent you from developing shingles. And to help protect you from any liver disease, hepatitis B is a vaccine that's used to help protect your liver. And here's a chart, just looking at on the left side of the chart, you can see the different immunizations that we have listed that are recommended. If you go across the top, you can see the ages that they are recommended. Now, this is only for adults. This is a different chart that we have for children, that they take at a younger age. But you can find several of these charts, like for the Center for Disease Control website, and you can get plenty of different charts like this. But it's a way that you can kind of look at it and say, okay, what vaccine should I be taking? How many doses involved and at what age? And so I want to briefly talk about cancer. I mean, that's our area of specialty. One thing I would say is that we have cells, we all have cells, and cells get old and they die off and your body reabsorbs them. But we have some cells that get old and they don't die. They start functioning abnormally. And over a period of time, these cells, they gather together to form tumors. And so when you have an x-ray done, like an MRI or a regular x-ray or a CT, this is what they see on the exams. They see these little nodules or tumors. And that's what it's okay, that shouldn't be there. But there also are some cancers that do not develop tumors, and that's what we call blood cancers. And that would be, for instance, leukemia, non-Hodgkin's lymphoma, multiple myeloma. These are some blood cancers that don't develop a tumor, but is also cancer. And so in the comment section, you'll see that there is a link to a website. You can click on this website link and it'll tell you what is the basic function of how cancer is developed, how you have a normal cell and they go bad. And then again, I want to emphasize that, cancer is the second leading cause of death. And so let's talk about some common problems for men, particularly the prostate. And so the prostate is a small gland of the male reproductive system, and it's about the size of a walnut. And you have the tubes that your urine goes through this prostate gland. And the thing about the prostate gland, it's a gland that continues to grow as you get older. And so when it grows, it becomes sometimes bigger than the size of a walnut. And by doing that, it can squeeze down on the urethra, which is the tube that the urine flows through from the bladder. And so it will give you problems like difficulty trying to start urinating or trying to stop urinating, or your urinating is slow, or it feels like you have to go several times because you're not able to empty your bladder. Now, this doesn't mean that you have cancer. It's what we call benign prostatic hyperplasia. And this is just the prostate being large. You can have prostatitis, which is an infection of the prostate. And it can give you those same symptoms. It can give you pain. And this is normally caused by a bacteria. So we can give you some antibiotics that can cause the infection to go away, and your symptoms will go away and you will function normally. Prostate cancer. Prostate cancer is the most common cancer in men after skin cancer, but particularly in Black and African American men. This is the worst disparity of any cancer. And African American men and Black men is almost twice as likely to die from prostate cancer than any group of men. We also diagnose at a younger age. And so therefore, screening is really important. And so I know there was a lot of confusion back in 2010, 2012. But for African American men, we recommend you start screening at age 40, at least get a baseline, and then based on that test, you can get screening every 2 years or every 1 year. But especially if you have a family history, you have a father, brother, grandfather that has died from prostate cancer, been diagnosed with prostate cancer, you need to make sure that you are getting screened. And for screening for prostate cancer, there's two particular tests. We have a blood test, which is called the PSA, where they draw blood, and it tells you what are the levels of the antigen, prostate specific antigen that tells you about the prostate. Is it high than it should be? And we use that to determine on how often you should screen. Also, you have a digital rectal exam. So you can see in the photo here, the prostate gland itself. The only way to access the prostate gland is through the rectum. And so we have what we call the digital rectal exam, where a provider will insert the finger in your rectum to press down on the prostate. One is to measure the size of it, also to see if there's any discomfort that's abnormal, as well as to determine if there's any nodules that's on your prostate. So that tells you that it could be a growth or something. So both of those tests together, the PSA and the DRE, is how you evaluate and screen for prostate cancer. In September is Prostate Cancer Awareness Month. So this is one problem, one cancer for especially African American men and Black men that we need to make sure that we screen it for. And like I said, starting at age 40. There are some guidelines that say 50 and 55, but there are a lot of Black men that are diagnosed in their early 40s with prostate cancer. So if you wait to 50, you won't catch it early. And so you need to make sure you advocate whenever you go and have your annual exam that if you're 40 above, that you tell them to check for it. Colorectal cancer, and this is a cancer of the colon, and especially the African American and Black men and women have the highest death rate when it comes to colon cancer. And if you recall, the Black Panther character Chadwick Boseman died from colon cancer, and he was diagnosed in his late 30s, and he died in his early 40s. But colon cancer, like I said, this is whenever you have a tumor in your colon, and they're called polyps. And so we recommend screening for colorectal cancer. And there's different methods on how you can do it. One could be, and you should start at age 40, at age 45, age 45, unless you have a family history, then you would screen sooner. But at age 45, we recommend you get a colonoscopy. And this is the opportunity where they can visually look at your colon. And if they see a polyp, they're able to have to develop, they're able to do treatment at the same time as they view on your colon, and they can cut those polyps off and remove them before they develop to cancer. And so we recommend the colonoscopy at age 45. Now that was a recent change over the last couple of months. Previous to that, it was age 50, but now the recommended age is at age 45. Lung cancer. Lung cancer is also a quite common cancer that has really poor outcomes. And we know those who use tobacco products and smoke are at the highest risk for developing lung cancer. And so we always emphasize people to quit smoking. But however, there are individuals who develop lung cancer that have never smoked. They've been around people who smoke, but sometimes there's environmental factors that impact or put people at risk for developing lung cancer. And the number one cause of people who have never smoked to develop lung cancer is radon. And so radon is an odorless gas that we have that comes from, the surface, and you can't smell it. You can test for it though. You can have a radon kit in your home where it tests your level of radon. You can send it to the state and they can tell you what those levels are. Especially if you live in areas where you have basements because of the leakage of the radon. So, like I said, that is there's a screen that we could do for that based on your history of smoking. So even if you have smoked in the past and you quit, you still at risk for developing lung cancer. So we recommend you, it's called having a low dose CT to determine whether or not you have lung cancer. They could test for nodules. So we need to do what we can to live a healthy lifestyle. And we need to do things to make sure that we stay healthy. So it's very important that we eat right and we exercise. And these things will really prevent you from developing cancer, diabetes, hypertension, having elevated blood pressure, high cholesterol, being obese, and having a stroke. Having a stroke because you have all this fat, or having the pressure, too much pressure on your vessels, and it could cause them to rupture. So we need to eat healthy. We need to watch how much sodium we consume. And people may say, well, why sodium? Why salt? Well, if you remember it from your physical science classes, water follows salt to help dilute it. And so if you're consuming a lot of salt, it pulls water and retain fluids. And so that helps increase your blood pressure when you have too many fluids. And so if a person have high blood pressure or hypertension, one of the first type of treatments that they give you is a diuretic that cause you to urinate, and so those are one of the reasons why you don't want to have a lot of salt. You need to eat a lot of fruits and vegetables and less meat. And if you eat meat, eat lean meat. It's important that we watch on how we prepare our foods, staying away as much as we can from fried food and do more bacon, broiling, and stew type foods. And I would also, as we talked about diabetes and elevated blood glucose, a lot of people think about, I don't eat a lot of sweets, or you have a lot of desserts, or drink a lot of sodas, or a lot of sugary drinks, those type things. But a lot of people don't pay a lot of attention to breads. So breads are carbohydrates, and those carbohydrates, bread, rice, pasta, those carbohydrates, they break down into glucose. And so you have to watch your intake of bread and pasta and rice as well. So it's not just the desserts. So it's really important to be physically active. And, there are multiple options that you can have to be physically active. You don't have to join a gym. You can do exercise in your home. But, you can go out, you go walking, you gardening, you can go biking, you can take Zumba. There's so many options. You get a videotape. You can do things in your house. You can walk up and down the stairs for a certain amount of time. You can have an exercise bike or treadmill. I tell people, if you have something like that, put on a show for 30 minutes, and exercise while you're watching it. It is really good to have somebody to exercise with, to have an exercise buddy, because these people help keep you accountable. Because there are days that you don't feel like going out to the gym or exercising, and that person, oh, come on, let's go. So it's good to have somebody to work with. And, you need to be committed. Do something that you committed that you can do. We tell people, okay, you can run 2 miles a day, but if you cannot maintain that, how about starting with, let's walk a mile at a time, then slowly build your way up, or start out with 15 minutes and go up to 20 minutes, but you have to do something and try to do it on a consistent basis. And so we talk about how much activity. Well, it's recommended that you have 150 minutes a week of moderate to intense aerobic activity, something that causes your heart rate to beat. So, you biking, swimming, like I said, walking, playing basketball in the garden, and we also recommend you do some muscle strengthening activities. So lifting weights, doing push-ups, and by lifting weights or working out those muscles, like I said, it helps reduce the amount of glucose that's flowing in your blood, and it helps your body, your muscles to burn that off. And so here you see that I have English, Arabic, Chinese, and French links here. So you can click on these links and it'll give you what are the recommended screenings in these particular languages. So you can review those. Like I said, look in the comment section, you'll be able to see those. We also recommend, we have some resources here. We have the Durham County Department of Public Health. If you're in Durham County, they provide immunizations. They also have what we call a BSEP program, which stands for breast cancer and cervical cancer program. So for women, that offers the opportunity to have mammograms and pap smears. But if you're not in Durham County, each county, almost every county has a health department, and they have some of the same programs. Lincoln Community Health Center, for those who are in Durham County, this is a federally qualified healthcare center. So they're able to see individuals who do not have health insurance or people that are underinsured. And so even though you may be in Durham County, if you're in another county, almost every county has a federally qualified healthcare center that allows individuals who don't have health insurance to seek care. And I can tell you, at the Lincoln Community Health Center, your first appointment, they'll tell you it'll cost you $20, but they'll tell you to bring some documentations of your income. And so that when you go there, they'll evaluate you and they'll determine how much you should pay because they have care on a sliding scale. It's not free. However, it's very reasonable so you can get care. If you have insurance, if you want to be seen at Duke one of our primary care clinics, we have a plethora of clinics throughout the state of North Carolina. And so there's a phone number you can call. If you want to be seen by a Duke provider, you can do that. And of course, the Office of Health Equity, we're here to assist you in getting a primary care provider if you don't have one. We're also here to give you education on what is recommended for types of cancer screenings. No matter where you are in the state of North Carolina, we can assist you. So please do not hesitate to reach out to us. Here are some resources for men's health. So you just click on these websites. You could type in any of these websites and get additional information. And I want to highlight the last one on the left column called Prostate Health Education Network. This is the most comprehensive website for African American and Black men when it comes to prostate health. It tells you what is a prostate, what is normal, what's considered abnormal, tells you about the different tests that you can take. It also tells you about treatment options. It has plays in there, because there's people, they have different ways on how they learn information. And so they have different plays that, you can hear a lot of the information throughout the plays. it's just all kind of access to information. So if you're African American male or Black male, I highly recommend that you go to this website because you get a lot of information. And on the right side, some other websites that's here. A lot of government websites within the .gov, like the Human Health and Human Resources. You got the Center for Disease Control. You have the National Institute of Health, and you have the American Cancer Society. And of course, you have Duke Cancer Institute, Office of Health Equity here as well. And we want you to do, I know you listen to this, but I really want you to take action. I know, men, we're taught to be tough, not to ask for help, but we need to make sure that we're taking care of our bodies, making sure that we're healthy so that we can be able to take care of our families. When you're sick, you cannot work. When you're in pain, you cannot work. And so we want to make sure that we're taking care of our families. We don't want to be a burden on our families. We want to actually provide for our families. So I want you to take action. If you have not seen a primary care provider or a doctor in a number of years, I want you to make an effort to go and schedule a physical exam, to see where you're at. I talked about the different tests when you go there. Ask about the different tests. We want to make sure that, based on your age, that we have these screenings for you. Ask about immunizations or vaccines that you may need to get updated on. Have that conversation. Talk about your lifestyle, how to exercise, how to eat healthy, because we want you to be healthy at the end of the day. And like I said, we're here to help you. The Office of Health Equity, we know, is a very complex healthcare system. It doesn't matter where you are in the state of North Carolina. We will assist you in establishing care with a primary care provider or a doctor, help you make an appointment. Also, you may make an appointment. If there's information that you need, we can help give you educational information. We can review the screenings that you should ask for, and we can provide any type of educational information that you may need. And I want to emphasize here, the Office of Health Equity, we talked about the patient navigation services. All those services are free. So you're not at all going to be charged for this service. We do this because we know that this is going to help decrease disparities. And we want to thank you for participating in our educational event today, but we want to hear from you. So in the comment section, we want to hear your feedback. There's a link there, and please take the time to fill out this short survey. Hopefully this information was beneficial to you, and tell us how we can make improvements and make it better. I want to thank you again for your time, and please do not hesitate to reach out to us. And this is just a list of references that we use to develop this presentation. Again, I want to thank you for participating, and I hope you have a great day.